Hello, Dr. Waqar. Good afternoon. Nice to meet you.
Hi, Dr. Khan. Nice to meet you too. How are you doing?
I'm doing good. Thanks for asking. How about yourself?
I'm doing good too.
Hey, how has been your day so far?
So my day has been all right. I think was just anticipating for the interview, had a nice breakfast, and then got ready for the interview. That's it for me.
Very good. Very good. What did you have for breakfast?
So yeah, I had a nice omelet with some hash browns.
Okay. Very good. Very good. Uh, why don't we start with you telling me about yourself?
Okay, that sounds great. So I'm from Rawalpindi originally, and I wanted to become a doctor since I was 5 years old. And that's because when I first saw physicians, when I went to see my baby sister when she was born, so that just kind of fascinated me, and I wanted to become a doctor since then. And well, I got into Rawalpindi Medical College, and I come from a non-affluent family, so I had to pay for my own studies. So I secured myself two scholarships while I was studying in med school, and which helped me, teach me, like, which taught me the concept of hard work and giving back to the community. And so I was part of a charity initiative in my college as well, and while I was doing my residency in Pakistan as well. And growing up, I had a family member, my aunt, who was struggling with schizophrenia. So that is how I got interested into psychiatry, and I did a 3 months of internship, like my house job in Pakistan, in psychiatry, followed by my 1 year of home country residency over there. And then I did my 3 months of US clinical experience here. Currently, I'm working as an observer at mental health services in Irving while I'm preparing for my step three as well. And well, apart from medicine, I enjoy the outdoors a lot. So, Islamabad has a lot of hiking trails to offer. So, I do regularly go there. And apart from that, I love swimming. And well, and I think that, it's been a long journey, but all of the things that I've learned from my experiences have made me a hardworking and a resilient individual. And I look forward to applying those to my residency program wherever I'm at.
Very good, very good, very comprehensive answer. So you said so you have done 1 year of psychiatry residency in your country. So tell me a little bit about that. So how do you compare it with? So you said you have also done some U.S. clinical experience, three
Oh, yeah.
months. So how do you compare your 1 year of residency and the psychiatric healthcare system in U.S.?
That's a really good question because I feel like when I was doing my psychiatry residency in Pakistan, when I would study the our course books like Maudsley, so when I would go through them, there were a lot of things which I felt like we were missing and not practicing over there in Pakistan because obviously we live in a resource limited environment. So a lot of these new long-acting injectables that are available in the US, we don't have them over here. We don't have them in Pakistan. So I felt like there was one of the differences was the variety of medications available. Moreover, I felt like there were a lot of differences in the neuromodulation techniques as well. For instance, where I was working, we were just doing ECTs, but and ECTs was with very limited options. For instance, we did not have the latest equipment where you can do voltage modifications over there. So, which I did get to see in my inpatient rotation while I was there in my externship in San Antonio. So I did get to see that experience firsthand as well. So that was really interesting. And apart from that, there's ketamine now, there's TMS now being introduced, which you don't have that yet in Pakistan. And I feel like moreover, one thing that I noticed as well was during my inpatient rotation, like there was a patient it was an interesting case who was not who was having intractable vomiting after citalopram. So he had his CYP, like the whole profile being done, and turned out he had his metabolism was slower. That's why we switched him to another SSRI. So these are the kind of things which I felt like were missing in Pakistan because we work in a resource limited environment.
Mhm.
So these things which I felt like were quite different, and that is why I wanted to pursue psychiatry in the
Mhm.
US as well to to learn from the best and to become a competent psychiatrist.
Okay. I have a couple of questions from what you have told me. So, one, you said the CYP metabolism. So, did you people do any genetic testing for that patient?
So yeah, the patient I had, he was like a 40-year-old male. So he already was coming in when his in from he came from his outpatient psychiatrist, so he already had that CYP genetic testing. Like for him, it was done already. So when we got through his profile and everything, that is when, when my attending was teaching me, basically, was that is how it
Okay.
happened.
Okay.
Yeah.
And by any chance, do you remember what kind of genetic testing was? Because there are different kinds here.
So the one I remember were there were like a couple of CYPs. They had done the CYP, like 2A,
Mhm.
3A. A lot of all of those were done over there in that patient.
Okay. So my what I was trying to ask, so there are different kind of genetic testing we do it here, and I don't want to name, of course, the companies, but there are different kind where they tell us how our bodies can interact with uh, common psychiatric medications. They would divide into classes like antidepressant, antipsychotics, anxiolytics, mood stabilizers, even stimulants, and then they also even talk about the folic acid conversion. So was it something like that?
Okay, sorry. Yeah, if you're asking me how you're that, like, yeah, because I've not seen a variety of cases. That was just one
Mhm.
interaction, so maybe I wasn't able to communicate it properly. But yeah,
Okay.
so it was the CYP genes. Along with that, there was one of those they had done like antipsychotics, and
Mhm.
apart from that, they had done anxiolytics as well, and the
Okay.
SSRIs and the SNRIs, and their
Mhm.
metabolism and their any interactions if they noticed, and the mood stabilizers were there. These are the five I
Understandable.
remember definitely. Yes.
Okay. The second question I have. So I have actually, over the years we have had Pakistani residents in our program, as you may be well aware. So actually, one of them is from one of the cities. I'm not aware of the geography of Pakistan, but I think he's from Gujranwala. And
Okay.
he actually told me that they are doing TMS there. So because you just mentioned that they don't do TMS in Pakistan at all.
Um,
So
it is available, but in very limited settings, especially
uh,
not in the government sector. I believe, like,
okay.
because I haven't heard about in government sector it being available. I've
Mhm.
recently heard about some private sectors offering it, but it comes at a lot of cost as well. So I
Mhm.
think its affordability comes in as well in
Mhm.
that
Okay.
perspective. So
Okay.
in my like vicinity in Pindi, Islamabad, I think maybe some private clinics might be doing it, but not
Mhm.
in government
Okay.
hospitals.
Okay. And you mentioned about the ECT. So what kind of an ECT machine your hospital in Pakistan uses?
Okay, so I'm not sure the kind of
Mhm.
ECT machine, but like I do know when I was talking to my attending over here in the US, that definitely it was an older version because we do not have the over here the voltage differences. You can look at those. You can
Mhm.
change that, then you can give like bitemporal or unitemporal or frontal ECTs. There are different modalities over there. We
Mhm.
just gave a standard voltage and just like the bitemporal ones, we didn't have any other options. So
Okay.
yeah,
So basically what you're saying is that you guys are only doing the bilateral ECT, not the right-sided unilateral in
yeah, no, we're
Pakistan.
not doing that. We don't
I
have that
understand.
machine. We
Okay.
were not able to do that. Yeah.
So and here in your rotation in US, your preceptor was doing both bilateral and unilateral.
Yeah, he was doing both bilateral and
Okay.
unilateral.
If I may ask again, it's not an academic question, but since you have observed and since you may know my background in the neuromodulation, what would be the main difference between the bilateral and right-sided unilateral ECT?
So in between bilateral and unilateral ECT. So Um, um, I think depends on the patient. Like the patient who's coming in, depends
Mhm.
upon them that we either give them bilateral or unilateral. For instance, I think that by it's unilateral is something that is preferred. I might not be recalling it correctly, but I think unilateral is something that is preferred, and because bilateral does come in with some cognitive deficits as well.
Yes,
So
very good, very good. Absolutely. So, bilateral is the conventional form, and of course, it impacts both parts of the brain, and it has more chances of causing neurocognitive decline, especially the delirium or temporary memory loss. But right-sided unilateral, because most of the people, their dominant hemisphere is left, so that's why they would do right-sided. So
okay.
it has low incidence of neurocognitive decline. Very good, very good. So, Dr. Waqar, tell me, in your opinion, I don't care about what other people think, but in your opinion, what is your biggest strength and what is your biggest weakness?
So I think I'll start with my biggest weakness. So I think my weakness would be that I am sort of like a detail-oriented person. You can say like a perfectionist. So I would say that sometimes when I'm writing down my notes, I would just like, go along, like write them like in really depth and detail. So, I would understand them, and the other person who I'm showing to is like able to understand that as well. But then I feel like that takes up a lot of my time as well and the other person's time as well. So, well, that's a work in progress for me, and I'm working on it. So, I'm trying to convey my point in a more concise manner. So I feel like that's definitely something I'm working on. And
Mhm.
I feel like my biggest strength would be my resilience, and my, like, I'm goal directed, and resilience would be my
Mhm.
biggest strength, because, and something that I felt like something that really helped me in this ability of mine really helped me
Mhm.
in my previous year, because I lost my father very suddenly last year.
Sorry to
So
hear about that.
thank you. And when he passed away, I was preparing for my step two. Meanwhile, I started my residency in Pakistan, and first year of training can be like tough. I'm sure anywhere you start. So that was tough. And meanwhile, I am the eldest daughter over there. So, my brother lives here, and I was in Canada. So I was the only one. I was trying to be their emotional support for my family as well, my younger sister and my mother. So,
Mhm.
it was like a lot of going on, but what got me through was just like resilience, and just kept going towards my goal. So I feel like that was my biggest that
Mhm. Very good. Okay, so my next question is about conflict resolution. So let's say you start your residency at my program, and during your intern year, you run into a conflict with one of your co-intern.
Mhm.
So how would you approach that?
Okay, so that's an interesting question, because I feel like conflicts in a workplace setting, you can always have conflicts.
Mhm.
But I feel like that the most important way to resolve a conflict is through effective communication. Because when maybe you are not trying to understand what the other person is saying, and maybe you're not able to understand what the other person is saying. So I feel like effective communication is very, very important. And this is something I learned from my experience, because I was the president of Research Society in my final year of medical school. So over there, when I was elected as the president, one of my class fellows was elected as the vice president, who was previously in the previous year was working as the editor of our student journal. So there we have like a very ceremonial sort of like we hand over the passwords, and the all the official documentation in a ceremonial, like the outgoing president's hand over to the incoming
Mhm.
president. So he was very adamant that I hand him over the passwords, and for the journal and everything, so he could start working on it, which I wanted him to wait over, because so we could start our work. So I think that was a point of conflict, but I tried resolving it by, I took him out for coffee. We sat down, I asked his perspective, and I told him what I felt like, we should be doing.
Mhm.
And so he understood that, it's going to be, I explained to him that, he's going to be handling the student journal anyways. So, it was just like effective communication that we resolved that conflict.
Okay,
So I
very
think
good.
that it should be that's the key to resolve any conflict that you have.
Yes, very good. I think that's a very good idea that you try to directly talk to that person, because a lot of times when we end up talking to that person, we find out that the conflict wasn't actually anything big. Okay,
Right.
very good. I would now ask you if you have any questions for me, my residency program, anything.
Oh yeah, I was looking at your residency program. Your website was quite self-explanatory and very comprehensive, but I did have a few questions.
Mhm.
So I think one would be that, how are there any changes that you've done recently in your programs considering resident feedback? Anything like those changes, like how well do you take in the resident feedback? That's one of the questions. And the other one is that what's being done in the program for the resident wellness? How is that treated? These are the questions I have for
Mhm.
you.
Okay. Yeah. So the to answer your first question, so whenever we the residents, interns, residents, they work with attendings. So our system of feedback works bilaterally. So the attending would give feedback and evaluation for the residents and vice versa. So resident would also evaluate them. So that's where we get the feedback from the residents, and we pay a lot of emphasis on the feedback we get from residents. And if there's any concern, we address that. So that is the official channel. And then as a program director, my doors are always open. I always encourage, starting from the day one, that interns, especially interns, because again, as you have said, internship in the intern year can be difficult and overwhelming. So I always encourage my chief residents to get in touch with the interns. We have mentorship programs where the interns are being mentored by early career physicians in our program. And even to some extent, the chief residents are also mentoring them. So we have different, you could say, filters where they could actually go and discuss. We have different avenues where they can discuss their problems. That's number one. For the wellness, we actually have a wellness residency wellness committee, actually run by our psychiatry residency program. And interestingly, it does not only involve our residency; it involves internal medicine, family medicine, and general surgery residency. So I think I don't think the information is available on the website, but they do have, I think, once a month meetups. They hang out. They plan dinners together. So they have some of that. So that is something that we emphasize a lot on, especially in New York City. If you are a resident, especially intern, there are some expectation. Of course, the workload could be higher. So we do realize, especially for international medical graduates who are not very much familiar with the setup, so we do realize how much wellness is important. So we try to pay a significant consideration on that.
That's very good to know because I feel like it's very important to have a healthy work-life balance to, excel in whatever you're doing. So that's good to know.
Absolutely, absolutely. Any other questions at all?
I think no, that's it from my side.
Okay, all right. Well, thank you. Have a good rest of your day. Best of luck for your trail.
Thank you so much.